Roadmap to Reality Beyond 2030, PLHIV Leadership, and the Sustainability Roadmap. So while I was preparing for this convening, Sher was in the background. So if you know Sher, right? Uh that she asked the question, do you believe in love after life? Was it? Do you believe in life after love? Um so that question has no relevance in this convening. But I think I can like rephrase that question in sustainability after all the funding cuts. I think that's the better question, or that's how to use best the question of sure. Do we believe in sustainability after all these funding cuts, or after all the landscape changes that is happening within the HIV programs all over the globe? It is so much an honor to welcome you in this very, very interesting convening. We are gathered today in this space, grounded in one simple truth. PLHIV leadership is not optional. PLHIV leadership is indispensable. And across countries and across contexts, PLHIV networks have long been the architects, or the architects of change, the stewards of care, and the voices that have carried sustainability forward, even when the systems that we have at the country level are lagging behind. Now, as we chart the sustainability roadmap 2030, we must begin with this simple, clear message. PLHIV communities, leaders, and networks demand and deserve access to accurate, timely, and transparent information about the realities of HIV programs across the national, the regional, and the global levels. Without this foundation of information, participation becomes symbolic. And we are gathered here today to have that information delivered to you. And we are very happy, and we appreciate the time of our colleagues from UNAIDS and from Global Fund to join us at today's convening. So let us move from vision to action, roadmap to reality, and let us co-create a roadmap that is not only realistic, but also based on our lived realities, the lived realities of people living with HIV. A roadmap that centers our wisdom, our experiences, and our lives. So thank you so much. Let us begin. I would like to call in our co-executive director, GNP Plus co-executive director, Sibo Nkosi, to provide us with, or to give us with some key messages from GNP Plus and to set the scene for tonight's convening. Sibo?
Thank you, Inad. And on behalf of GNP Plus, I'd like to welcome everybody. Again, I think my name is Sibongile Nkosi, and I am one of the co-executive directors. And I think really for me, this moment really presents us a moment. It's a moment of pausing. It's a moment of reflection. It's really a moment of planning. So I think right from the beginning, as GNP Plus, when we decided to really convene the PLHIV networks, it really gives us a moment to really reflect. So I like your question, Enad, around so what happens beyond 2030? And I think it's such a critical question. But I think for PLHIV networks, I think we continuously are asking ourselves this question. And we don't want really complicated things. We want really simple things. And I just want to open this conversation with that as we think beyond 2030, really what we would like to see as people living with HIV is a world where treatment is accessible. Again, I think prevention is routine and simple, where we are stigma-free. And really every person, regardless of where we are, where we live, we have a right to a healthy future. So as we talk about sustainability roadmaps, I really want to just highlight that really the sustainability roadmaps are the foundations of the road ahead. But we must think about what do we want to see beyond 2030? What are the achievements? As we also reflect right now, I think this moment is giving us an opportunity to reflect right now of the infrastructure that we've built in PLHIV networks, of what the vertical health systems have given us, particularly around HIV treatment. More of us are on treatment. There are children that are born there are children that are born HIV negative. But I think I just want to highlight that for us, really, 5 fundamental key things that we want in the sustainability. 1, beyond 2030, really for us, sustainability means ensuring that treatment remains consistent, reliable, and accessible. What does this mean really for countries, as we can see that the HIV response is really moving at a country level? It means really we need to make sure that there's stronger investment in supply chains. This means that scaling up our production of medicines and also really embracing innovations like the long-acting injectables and prevention methods. I think it must be, I think what we need to think about is just not the progress in terms of like short-term victories, but we really must measure the continuity of what we've built upon. Another aspect for us really is around financing the future. So beyond 2030, countries must build domestic financing mechanisms, and what we want to see is HIV being integrated into health, into primary healthcare, but also exploring innovation funding models. So therefore, sustainability really means that taking ownership and that HIV programs must be protected even when global priorities shift. Another aspect that is really close to our heart at GNP Plus is making sure that beyond 2030, we build strong health systems. Therefore, we do not want to see HIV services standing apart, but we know now that we want to see them integrated in primary healthcare, in maternal services, and also in our pandemic preparedness work. And lastly, I just want to also add around, one of the things we are embracing is around innovation and equity. We must also harness the power of innovation, self-testing, digital adherence tools, AI, and then also, lastly, I just want to talk about that we can't do the sustainability work without talking about human rights in our communities, particularly when we talk about stigma reduction. So therefore, as we talk about sustainability in these conversations, I just want us to leave us with just simple things that we want to see, particularly from GNP Plus side, that we envision that beyond 2030, is this what we want to see? So yeah, Inad, I'd like to hand it back to you, but really looking forward to the conversations today, as this moment really is asking us to really reflect and plan ahead. Thank you.
Thank you so much, Sibo, for that wonderful message, the message that will really start the conversation. Thank you so much for asking those questions. But one important question is, do we really understand the sustainability roadmap, or how do we understand the sustainability roadmap amongst the PLHIV networks? And we are here. We welcome our colleague from UNAIDS, Jaime Atienza Azcona, who will share the overview of the sustainability roadmap, part A and part B. And after that, our colleague Clayton Eusebio will also join in the discussions. So Jaime, the microphone is yours, and thank you for joining us.
Dear colleagues, dear Inat, dear networks, dear people living with HIV networks, I want to first thank and commend the role of GNP Plus throughout this process and the dialogue on advancing sustainability discussions with a clear vision coming from people living with HIV and communities. It's not been easy. It's been a process that has moved fast. It's complicated, and although it's very basic, and Svongile was very right to say we need to go down to what's essential, it also has a significant degree of complexity, because that's how the national systems are. So we have all these ingredients. I hope that's something. Inat, are you hearing me correctly? Okay, I see some thumbs up. Good. I was just saying this, thanking you for all this. Going back to something that Svongile said, the sustainability is something that is looking at what happens, what is the system, how it will be settled in the future. So where is it that we will be in 2030 once most of the donor money, or there will be a much less significant amount of donor money than has been. We didn't knew that the reduction was going to be sudden and so strong as we have seen, but thanks to the sustainability work, reflections of your networks and of different actors, I think we are better prepared for this time of disruption and time of transformation. I think Svongile has said a lot of the things that matter, that really matter. So I don't want to insist in those. I'm going to share my screen briefly so that I can put some key messages, and that goes faster into our discussion. Let me try to do this right now. And the first thing I wanted to give you is let's see if this moves forward. Okay, it was simply an overview. So, the HIV Response Sustainability Roadmap, we started working together on this. UNAIDS' role has always been to facilitate the dialogue and the country process, supporting government and ensuring community participation, and working hand in hand very closely with PEPFAR and the Global Fund as during the first year, and advancing now with some more or some less of that as a result of the current circumstances. I think this is a snapshot to tell you which are the countries that completed their Part A, which are the countries that are developing a Part B, and countries that are simultaneously developing Part A and Part B. The Part A, as a reminder to keep it short, was where countries were discussing the vision for the future and identifying what were the key transformation. What should the response look like beyond 2030? And that would set what are the key steps that need to be taken. The Part B, that some countries are developing simultaneously, that some countries are advancing after their efforts, is where concrete plans that are coming down to earth are set, including the financial division of labor between the different actors. The idea is that the sustainability roadmap can provide a unified budget that countries can look at and that can serve for dialogues and coordination with the main donors going forward, so that all the needs, all the pieces are there, and even when there's much less money, it's easy to identify what are the choices and what are the difficulties. Well, we've seen strong national leadership, and this also, the work of the roadmaps and your contribution, we had like around 30 countries that had either finalized their Part A by the end of the year or were working on it. So that enabled them to go for a shock response and mitigation measures that were well grounded. This is something that came up in several of the meetings we have been participating at the beginning or in the first half of this year. I will not go through the cases because you can see there, those are just snapshots on how sustainability has helped drive decisions and actions. As a result of the immediate financing shock, in UNAIDS we developed what we call the Rapid AIDS Response Financing Tool. That's a tool where we have created country profiles for 35 countries using the information that was available before the information was pulled out on the granular details of PEPFAR investments in countries. The purpose was, together with Global Fund and together with governments, the purpose was to have all that information so that it could be used by countries, it could be used by the Global Fund in the revision that they had to do during this year. It could be used by all parties to see where the monies are, where they can be reduced. It has also a function of transforming international costs into domestic costs, so that there is this realization of a more efficient response. I think here I will just share the slides after we speak. I think Some clear aspects that we see as opportunities is that we've seen increased national leadership on sustainability of the HIV response, and we know there are also other sustainability dialogues going beyond. We have our Global Fund colleagues here, so of course malaria, TB, and the health systems elements to enable this to happen on integration and the sustainability of the health system. Sustainability has been growing, and the roadmaps have been an important platform on the field of HIV for domestic leadership, community engagement, and donor coordination and partnerships. In the Global AIDS strategy that is being discussed and will be adopted in 2026, sustainability has been also highlighted as one of the key elements. And in the board of UNAIDS last December 2025, that seems ages, December 2025, 2024, I don't even remember in what year I'm living in. We had this fantastic board in Kenya where sustainability was one of the key points, and there was a request to report recurringly year by year on how countries are advancing. UNAIDS has provided some thematic guidance on approaching sustainability in the SRMs, and my colleague Clayton will speak to thematic guidance on communities and human rights. On the risk side, of course, we have international funding decline, and then we have donor funding that comes with co-financing, with conditionalities, and how these evolve, we don't entirely know, and whether these will bring divergent views on key political and policy issues, we don't know, but we can anticipate that there will be. It will be important to continue in the dialogue and to continue empowering communities and people living with HIV to ensure going forward this role is clear. We have also seen how communities were at some point not sufficiently prepared or engaged or receiving sufficient support for that engagement, and there are different versions of these. We have been working together with GNP Plus and others to try to provide part of that support, but there are limitations, and there have been more limitations after we lost a significant amount of the funding we had for this purpose. There are still many unknowns on what are the elements of sustainability that will remain, but we can say that integration, as Mongile said, is present everywhere in all the roadmaps that have been advanced, and that community systems and social contracting as a mechanism was included in this part A. We need this to be in the part B when the concrete plans are made. And it's important to say that with the sudden financial shock that started this year, at the beginning of the year, the transition element of the roadmap has grown irrelevant. It was going to be a slower transition, a more progressive transition. Now we need to adapt to reality on how to support countries and how to support people. And that's what we need to be doing now, once we know that the timeline for transitioning out or transitioning to reduced donor funding is going to be much faster, and that is an element that is so important. These are just some of the products you have. There is a sustainability.unaids.org. I think we need to. I just invite you to see all those pieces. We already have the companion guide part B, looking at how the transformation plan. That's the main point of the part B, and I'm going to finish with a quick summary of what this part B is about. There's the HIV financing outlook. We want to make it clear what is visual, what are the data, where are the investments, so that we all know, you all can see, can touch where the resources are, where the future may lead, where the risks are, what are the things that need to be protected, and of course, assessing all the financing opportunities, financing needs. And I'm glad that we have our colleague from the Global Fund Health Financing team here that can speak to some of these dimensions. But that's a key element of the Part B, as I said, because of the accelerated transition timelines. We can say this is especially relevant. Just the transformation plan, that's the key. The core of this part B is how are we in the part A? We identified what was the end game, how was the system, what would the system need to look like. Now we are looking at what are the priority actions on different areas, on political leadership, services and solutions, financing, enabling laws and policies and systems. All these elements are to be present. And it would be important to do this risk assessment. We think it's critical to do risk assessment as we move forward, because we know there have been great achievements in HIV, not that everything has been achieved, but we've advanced very much together. We've achieved results together. And we know that in the current context of disruption and of big transformation, we are going to make a good collective effort to identify the risks and also mitigate those in the different areas. And you will see there, when we look at enabling laws and policies, that we see some of the elements that can happen, some of the risks that can materialize, and there will need to be responses. These need to be identified as risks, but this should lead to the action in the redesign of national responses. I think I'm going to stop here and hand it over to my colleague Clayton. I think just with one final phrase, once again saying sustainability roadmaps are a tool to support people living with HIV, a tool to support country systems in evolving, and a tool to support countries' leadership in the dialogue with key partners going forward. Your role remains essential, and UNAIDS remains deeply committed to do all we can to make it work at country and at global level. Over to you, Clayton.
Thank you. Thank you very much, Jaime. And thank you, GNP Plus, Sibongil, Linad, Elen, and all the team for inviting us, for inviting UNAIDS. And also thank you all that joined this convening today. I will be very brief because I don't want us to, I want us to have time for discussion at the end. I will just show maybe 3 slides of this document that we are working. Our community, human rights and gender teams at UNAIDS are working, and we receive it. And I want to thank you, GNP Plus, that provided comments on the first draft of this guidance that will be supplementary document to the Sustainability Roadmap Part B, that is focused. This document will be focused on ensuring a rights-based, gender transformative, and community-led approach to sustainability planning. And I will focus only on the community-led elements. I think Jaime talked already about this, how we are facing this global financing crisis that is affecting very much community-led organizations and civil society organizations, but also at the same time, we may see this as an opportunity, and sustainability planning allowing countries to really strengthen ownership. And for that to happen, it will be really important, these renewed partnerships between communities, governments, donors, health providers, and private sector. And in this partnership will be critical that to value community knowledge and to bring it as a central element, community leadership, including the leadership of people living with HIV. So this guidance, it sets a bit of principles, minimum standards, and non-negotiables for community engagement in sustainability planning. Here is a list of principles, nothing super new. And of course, all of you work already on this, like on ensuring the GNP principle, gender equality, also important for meaningful community engagement, human rights-based approach. I will mention one more, that is the importance that all aspects of community-led responses are supported, and that will include community-led service delivery, but also advocacy, community-led monitoring, and research. And we have some additional principles that are listed here. We also try to put a list of what would be standards for meaningful community engagement, both in terms of decision-making processes, but also in terms of service delivery. I will not read all of this, but we can share this after the call. But the ensuring representation of communities in all working groups, subcommittees, making sure that these nominations, they are done via community-led organizations and networks themselves, not individual nominations. The importance of formalizing with terms of reference so you can really have defined roles and selection criteria, and also accountability channels. Prioritize safety, including the confidentiality of participants when requested, and also establishing safeguarding mechanisms. The costs, as much as possible, communities should be supported to meaningfully engage it. This could be including support costs of travel, of participation in meetings, etc. And also enable the preparation that also communities have the time and support for reviewing documents and preparing for meetings. And an important one is also that the representation reflects the diversity of people living with HIV and also key populations and other priority populations. In service delivery, we also have some standards that should be the prioritization of community-led organizations, for example, including when social contracting mechanisms are being used. Of course, we know that in some contexts, community-led organizations may not be strong or maybe even absent, so it's important to engage community leaders and volunteers and investing in strengthening community systems, scale up of CLM, ensure fair pay and the protection for communities, and also as much as possible trying to monitor the 30/80/60 targets and establishing systems to track and report progress. Of course, we know that the context will vary a lot depending on the country situation, the level of development of community-led organizations. But the importance here is to make sure that there is sustained support for community engagement and some levels, some minimum levels. I think the main message here is that we need to make sure that at minimum, some minimum levels of community engagement should be non-negotiable. And then we will have a list of what should be this minimum. We can call minimum standards or we can call non-negotiables. I think we are still discussing how we will call this, but here is a list that we can also share after the call. But for example, the engagement in decision-making platforms is really a minimum that communities need to be part of the decision-making processes. Peer-to-peer programmatic components should also be included. Community-led monitoring of non-community-led services, especially for underperforming areas. The legal protection of people living with HIV, key and other priority populations. And also, if public funding is not sufficient, there should be coordinated efforts to seek alternative funding sources, including but not limited to international donors. This could also include, for example, private donors. So here is just an attempt to summarize what should be the minimum of engagement of communities in this process. And then the document will show for the different domains of the sustainability roadmap, how do you apply these standards and non-negotiables. I think I will stop here because I think we might have already surpassed the 15 minutes, but we'd be happy to respond to questions at the end also. Thank you, Inad.
Thank you so much, Jaime. Thank you so much, Clayton. I see a hand, but we can have the questions after all our panelists have presented. But you're free to type in your questions in the Q&A box. Thank you so much, Clayton, and thank you so much, Jaime. for highlighting what the roadmaps are for, what's the difference between Sustainability Roadmap Part A and Part B. I am interested in the risks in Jaime's slide, as well as the human rights based approach that Clayton has presented, as well as the non-negotiables of community. I have questions myself, but I have some questions myself, but I'll allow the participants to type in your questions in the Q&A box. We have our colleagues from UNAIDS who will be helping in responding to those questions. So the application of the Sustainability Roadmap has been really the interest of the community, particularly the PLHIV networks, as to how we are going to engage in these processes. So GNP Plus did a so I'm not going to I'm going to share a screen, but I will just have to quickly share this with you. So GNP Plus has a comparative analysis. We had an exercise of the HIV Sustainability Roadmaps on Part A. So this exercise assesses the participation and engagements of the PLHIV networks in 9 countries. But before going to that, I'd like to say that the community and the PLHIV networks are in the discussions about sustainability for a certain period now. We are not doing this convening, or we are not having this discussions on sustainability because the sustainability roadmap was launched or was developed. But we have to also acknowledge that us, the communities, and the HIV networks have been talking about sustainability for the time being now. And there are several groups or committees or advisory groups at the global or regional level that we have actually participated. I think some of us has been into this or are part of this groups about sustainability. So we have the Global Task Team on the guidelines, targets, and tasks of the UNAIDS. We have the advisory committee on the UNAIDS HIV Response Sustainability Approach, and the PEPFAR Sustainability Approach regarding the PEPFAR 5-year strategy, where we were all, I think some of us were in Washington, D.C. 2 or 3 years ago. But regarding the analysis, so GNP Plus assessed the engagement of people living with HIV in the roadmap processes, particularly in the key areas where community engagement financing mechanisms and enabling laws and policies which are crucial to sustainability. So in this regard, we have to also acknowledge that different countries or different regions have different contexts, and the mechanisms or the laws and policies which may be crucial to sustainability may also be different. So this initiative supports the UNAIDS aim for country-led sustainability, HIV prevention, treatment, and care beyond 2030, and how, like, as recommendations, how are we moving forward in terms of engaging with the UNAIDS Sustainability Roadmap. Just a reminder, this report is still not yet final. The team is still finalizing the report, but we can already go towards the recommendations. So these are the recommendations in terms of the community engagement. So in terms of the financial and policy support, the governments must invest in community-led health systems through financial and policy commitments to ensure sustainability. Again, this has been a recurring recommendation from the community, regardless of the region or regardless of the country. And we also recommend the recognition of community health workers, where the PLHIV and key populations enable access to employment, training, and protection, or employment safety. The recommendation on peer-led and culturally relevant services, where peer-led HIV services are tailored to cultural context to foster trust and improve service uptake among affected communities. And of course, we are also advocating for institutionalization, where advocacy efforts should embed community engagement principles in national policies and funding mechanisms. I think this has been reflective of the presentation of Jaime and Clayton earlier. In terms of financing and social contracting, there is a recommendation to institutionalize social contracting. At the moment, I think social contracting is still a fragile mechanism, but there are very good models from different parts of the world where we can use in terms of institutionalizing the financing mechanism within the social contracting. We recommend prioritizing community groups, and we recommend flexible and responsive funding, meaning the funding mechanisms must adapt to changing health needs, demographics, and political landscapes. Adapting meaning adapting to different context to where the demographics and political landscapes are, in particular to a country. And the recommendation for community-centered HIV response, where we are positioning communities centrally, so that we can enable more effective, equitable, and sustainable HIV service delivery. In terms of the laws and policies, the assessment has provided, or has as a result, there are 4 areas where the areas in terms of enabling laws and policies. So the criminalization of HIV and related behaviors still remains a barrier because it creates stigma and limits access to vital health services. The poor or ineffective integration of HIV programs within the broader healthcare system causes service fragmentation and inefficiencies. There is absence of emergency legal aid and digital security for community activists, and it weakens community health leadership. There's a need for comprehensive legal and policy reform to enable rights and health for key populations. Now, from this presentation, I think the 4 areas are perennial or perpetually the challenges in terms of the laws and policies at the country level to enable the leadership of people living with HIV and their access to health services. So these are the overview of the progress of the roadmaps on part A, but that has been already discussed earlier. And then these are the when we mapped out the social contracting status by the countries that we have worked with, there are varied social contracting progresses across countries. But again, this is it's not difficult to embed or to integrate social contracting within the financing mechanisms, because different countries have different ways of financing communities depending on the context, and countries show different levels of adaptation in terms of in terms of implementation across Africa. So this is only across Africa. In Africa, the leaders in implementation include Namibia, Tanzania, Zambia, and Zimbabwe. And if there are participants from these countries, we hope we can hear from you later. Challenges: Kenya faced setbacks due to funding interruptions, and Malawi lacks social contracting in its sustainability plan. And the highlight of this is the importance of social contracting, where social contracting funds community organizations and sustains HIV services effectively across regions. But we will be hearing about this more later from our panelists. For the final recommendations of the assessment, we recommend the continuation or the continuing engagement of people living with HIV. We must strengthen our involvement in planning, implementation, and monitoring of the sustainability roadmap, or any exercises that pertain to sustainability of HIV program. We must secure domestic financing. Countries must secure the national budget financing to sustain HIV programs beyond external funding. And I think this is where our advocacy will play an important role. How do we engage in domestic financing? How do we engage in the discussions? We must build community-led health systems, resilient community-led health systems, empower local actors, and improve HIV response effectiveness. And the legal institutional reforms, where reforming legal reforms and institutionalizing social contracting fosters enabling environments for affected populations, especially people living with HIV. So this presentation, so the assessment was actually led by my colleague Cedric Hasbe, who's not able to join us. And the presentation is prepared by my colleague, wonderful Abby, So thank you so much for that. So the assessment results has shared that there are still, like in the 9 countries in Africa, shows that there is still need for community engagement. We still have to agree on the kind of social contracting or funding mechanisms where the domestic finances can be channeled towards the community-led organizations or PLHIV-led networks, and also making sure that we are actually looking at the laws and policies, how we are going to change the laws and policies to make an enabling and friendly environments for the operations, not only for the, most importantly, for the key populations and people living with HIV, but also to enable the operations of PLHIV and community-led networks in terms of providing services. So that's for like a 9-country like vision. But we have, as part of our next panelist, we have Cyprian Narcis Comba from NYP Plus, who will share with us his own experiences on how is it to be involved in shaping the sustainability plans at a country level. Cyprian, how can we move beyond participation towards co-ownership of sustainability plans? And how do you think social contracting mechanisms be reimagined when we talk about sustainability?
Okay, thank you so much. First and foremost, I would love to introduce myself again. I'm Cyprian Komba from the United Republic of Tanzania. I work with the network of young people living with HIV. Personally, as an individual, but also as a representative of the network, I've been engaged throughout the process of developing HIV Sustainability Roadmap at a country level. To set the background very clear, I would love you all to know that in Tanzania, the HIV Sustainability Roadmap was developed through the 3 consultative phases that involved the dialogies, the assessment, but also finally the actual development process of the sustainability, HIV Sustainability Roadmap. The PLHIV leaders, as ourselves, we were engaged throughout the processes. But to make this engagement true, we wanted to ensure that the ownership requires moving from being consulted and being decision makers. When we wanted being decision makers in a different areas, that starting from defining our roles, but also knowing our authorities in their governance, including shaping priorities, directing resources, and ensuring accountabilities of the communities in the spaces. So for us, ownership, it means, like I said, the PLHIV leadership must have been defined laws and also authorities and governance, including shaping priorities and directing resources to ensure the accountabilities of this. For instance, here in Tanzania, we after the sustainability roadmap we have developed, there's those indicators that we were supposed to work on, including coming up with a task force for social contracting. As a PLHIV leaders, we pushed to make sure that we are part of the governance, we are part of the decisions, and we are part of those task force. And we were not supposed to be there as only participant, but we wanted to be there as a decision makers. That we sit together, we set priorities together, but also we know our priorities. We can push our priorities, and I know it has been a little bit hard sometimes. This backlash from the partners in the room, that when we're representing community priorities, community preferences, they would say maybe this is not feasible. But us as a community, because we are representing the community, we would always stand saying that this is not us, it is what the community told us, it works. And we do believe that community are the center of delivering those programs. So we worked tirelessly to make sure that we push to be part of each decision-making platforms, and not only as a participant, but as a decision makers. And we consulted our communities to make sure that whatever we are representing, it is really what comes from the community. So how can we move from the participation to co-ownership? Is only by making sure that we do consult our communities and we kill their voices without fear. And we push for what matters most to the community without fear on the table. And whatever we're receiving those arguments from the whatever partners, government, and anyone in the room, we would always be passionate saying that this is not what it's coming from from an individual, but this is the voice of the communities that we are representing in the decision-making platforms. I think that marks the end of that question you have asked on how we can transition from participation to co-ownership of shaping strategies, especially in the spaces of traditional dominated by the institutional actors.
Thank you. Go ahead.
Yes.
If you have more points.
Yes, moving forward, I think I'll go directly before you ask the other one. I'll just talk also about on how social contracting mechanism can be reimagined to reflect the realities and the leadership of the PLHIV communities rather than just funding for service delivery. As we all know that traditionally social contracting mechanism was meant to provide financial support to the NGOs to deliver services. And this model is risking reducing the PLHIV communities to implementers rather than strategic leaders. And what we want is to be the strategic leaders. Here in Tanzania, we have developed a guideline for social contracting. Now we are in the process of developing the guideline for social contracting. And next week we'll be meeting to just have a dialogue for it. And we ensure that we have been given space for us to just prepare ourselves for the communities, but also consult our fellow community who we are representing to just get their insight. For them also to just understand what is the social contracting mechanisms and how can benefit the communities in need of the services, and for them to come out with their priorities, preferences, and what they would love to see it's happening in social contracting. So we asked them to just give us time. They gave us time. We consulted our community. The next week we'll be meeting to just develop the guideline, because we thought without having a guideline in place, we will be missing out different things that are much important for the community. So we do advocate and push for the community system strengthening and leadership, and not only services, because for quite some times the community have been pushing for the services, but as of now we are transitioning. We are not only pushing for the services, but we are pushing for the community leadership. We are also making sure that we advocate and provide insight to the community that we are serving, for them to understand what should be done for the long term when it comes to work with the community. So there now we are pushing to provide multi-layer multi-layer contract for the PLHIV network, so that we can have a long-term plans to sustain the community that we are serving. And at the end of the day, we are working to make sure that we are embedding community-led monitoring and accountabilities to make sure that we can be able to monitor services that are not offered by us community. Moving to the my own views as an individual engaged throughout the processes for the sustainability roadmap development process and even the implementation of the sustainability roadmap. First, I will acknowledge that there's been a community engagement, but for quite some time it is we're getting it through pushing. It is not coming easy from the government sides or even from the other partners. They would feel that community should not be part of the those decisions, but we've been pushing constantly to make sure that we are part of the processes, and then they do understand that we are there to represent the communities. So the domestic resource that we fought for in our process of engaging the community, that we came up with an ideas on how the government would outsource fund to sustain HIV response at this critical turning point, at this critical funding turning point. There is where we got the commitment from the government, for instance, here in Tanzania, and we have a colleague from UNAIDS presented that we have launched the new finance bills, which was started to be implemented on July 2027 this year, of where we have added taxes to we have added sin taxes so that we can collect those funds and and put it in the aid trust fund bucket that we have in our country, because we had that aid trust fund bucket which was not having the source of fund for the bucket to be able to implement different program at a community level. But we advocated to see that at least we have a prescribed source of fund that will be filling the basket of the aid trust fund, so that we are sure that these programs and services will not be disrupted at a country level. So we worked together with the government and we offered them the different sources for them to just get the fund for the basket for the aid trust fund. And now we are happy to see that we have started collecting fund, and we are sure the fund will just come for the communities. When it comes to the national HIV response, I would always argue that as a communities, we should push to see that we are institutionalized in the different platform, as I insisted, areas. Whether it's a task force, whether it's a technical working group, whether it's the oversight bodies, we should be there. And we need to educate ourselves to make sure that we know what is really happening. And if we do not get maybe to just understand or being able to know what's really happening on that side, it is a key point now to see that how do we engage with the technical people who knows those things how work, so that they can support us to be part and parcel of the processes and engage meaningful and contribute meaningful. Last but not the least, I would like to comment or say that at this critical turning point in the HIV financing, we must ensure that people living with HIV leadership is not a symbolic but is structural. Everyone should commit to co-design the sustainability strategies of the people living with HIV and the community at risk of contracting HIV, because we do believe that as a community, sustainability is not it's not possible without the communities, and the community cannot sustain without the leadership. Thank you so much.
Thank you so much. Thank you so much, Cyprian, for those very grounded points about your experiences in sustainability planning at the country level. I'd like to highlight your points on PLHIV leaders as decision makers, as co-owners of the sustainability plans, highlighting the need for support for technical knowledges for the community, technical knowledge or sets of technical knowledge for community, and making sure that the PLHIV leadership's participation is structured within the planning and not merely a consultative figure or not symbolic figure in the sustainability implementation of sustainability roadmap. Thank you so much, Cipriano. From that part of the world, from Africa, we're going to Asia. We have heard the community's points on sustainability roadmap. Now we'd like to hear from the experiences of UNAIDS country office, UNAIDS Cambodia. We welcome Patricia Ongpin, the UNAIDS country director for Cambodia, Laos, and Malaysia, to share the experiences at the country level, like what happened, what are the processes, and how do you think the PLHIV network's engagement are in the sustainability roadmap exercise. Over to you, Patricia.
Thank you so much, Inad, for that introduction. I hope I'm coming in clearly. Good evening from Phnom Penh and the new airport. I'm actually in transit to fly very soon. I think I'm going to be touching a lot on what has already been said by most of the speakers, all of the speakers. And fundamentally, it's that people living with HIV's communities have an essential role, and I cannot emphasize that enough, have an essential role in sustainability of the HIV response. Not just in finances, as Jaime and Clayton had mentioned, but in other areas apart from financial investments. Next slide, please. So what I'll tell you now is, like I said, what you've already heard all night, but from the Cambodia perspective. We've been doing this in Cambodia for a very long time. This is a journey of what Cambodia has done for the Sustainability Roadmap. It actually started in 2017 as a transition readiness assessment, where we understood how is it that Cambodia can prepare itself for sustainability, which then transitioned into 2018, creating the first version of our Sustainability Roadmap. Cambodia was the first country in Asia Pacific to do this sustainability roadmap. This is an old generation, so it's not what you may be familiar with now in the context of the primer and the companion guidelines. In 2022, we also had a review of the sustainability roadmap and what has been achieved in the 2018 version, which created the 2023 to 2029 version of the new roadmap. Next slide, please. In the middle of that, we also did several capacity assessments, and it's great to hear multiple speakers today talking about these assessments. One such assessment that was very important for us was one on social contracting, where it revealed the critical gaps on financial management, governance, and the readiness for social contracting among civil society organizations, including people living with HIV. So based on that assessment, it informed how we were updating the 2022 version of the Sustainability Roadmap, because this assessment was done in 2020. It informed how we would provide capacity building support for the civil society organizations and people living with HIV in order to address the gaps that were found in the assessment. So in the Sustainability Roadmap strategies, currently you'll find pieces on inclusion in national frameworks, diversifying financial mechanisms, including social contracting, but not only social contracting. Recognizing CSOs having a fundamental contribution to the HIV response and improving CSO working conditions. Next slide, please. So now the current version that we have in 2023 and 2029, again, this was done all the way in 2022, so it's not in the same version that you know of Part A and Part B, really focused on highlighting 4 areas that had risks and mitigating actions. And here you see in the red font, I want to highlight 3 risks related to CSOs and CBOs were specifically mentioned, including for community networks. Next slide, please. You should be able to access this document online, but here is the page that specifically mentions the 3 risks related to the civil society organizations. I won't read the graphic on the left, but what I want to highlight is that it explicitly mentions and maps what civil society organizations contribute to and need from the Sustainability Roadmap. There are elements that highlight, as I mentioned earlier, strategic engagement, capacity building, and accountability mechanisms in order to position the community to do all what the speaker said earlier, not just to be a part of the dialogue, but really to lead and own the dialogue. And finally, the roadmap also provides information of how we should be funding and finding additional funding to support CSOs and CLOs to include in sustainability. Here in Cambodia, we have an investment from France and Australia to support with sustainability. I'll talk about that a little bit later. Next slide, please. So in the roadmap that we have, as I had mentioned, people living with HIV are fully engaged in all the platforms in sustainability planning. This includes in the CCM. This includes in what we call the government donor joint meeting, which is the highest body of meeting that contributes into the national strategic plan of the country, the pentagonal strategy. This means that communities and CSOs are active in that conversation with interministerial bodies and development partners to monitor the process and progress of sustainability in the country. There's also inclusion in national strategic plan development, global fund submissions, and the technical working groups that relate to sustainability. People living with HIV are in all these national consultations and dialogues. The box that you see in the bottom is a large milestone for us. It took us half a day just to come up with those words in that box. It's the definition of what sustainability means to Cambodia. And it was really important for us to highlight what that, to define something about what we mean by sustainability so that it's Cambodia owned and that it's specific to the context that we have. This was created as well with government development partners and all key populations and people living with HIV, which is why you'll see in the second and third line, ensure inclusive, local and community-owned and people-centered HIV-related services. This was very important for people living with HIV and the key populations to include in the definition of sustainability of an HIV response in Cambodia. Next slide, please. So what are opportunities to co-create and enhance people living with HIV's roles and sustainability? And you've heard it many times in many different forums. The first is participation in leadership and decision-making tables. But it's not enough to just show up at the table, but to actually be proactively sought out and engaged and asked for active roles on the table. For instance, in the CCM here in Cambodia, key populations and CSOs are the co-vice chair of the CCM along with me, and the chair is the Ministry of Finance. So these are key leadership decision-making tables that we are able to ensure that CSOs and PLHIVs have a space to say what concerns them and drive the response. A second opportunity is continuous feedback loops. Here, I want to highlight community-led monitoring. It's a fantastic loop here that in Cambodia that not only provides program improvements for the CSOs and the CLOs in their service delivery, but it feeds into the government response. And finally, as many people have said, institutionalizing PLHIVs and CSOs into the HIV response. Next slide, please. So this, I believe, is my last slide. Just some areas I would like to highlight about where UNAIDS and people living with HIV have worked together to strengthen our collaboration to move the agenda of sustainability forward. The first is joint advocacy. nothing alone, right? We must move together. So joint advocacy to formalize people living with HIV representation in all relevant technical working groups. Joint advocacy also to ensure that communities are demonstrating cost effectiveness and impact in all of the submissions to Global Fund. We also must ensure embedding community priorities in the Global Fund grant. A key thing that we do here in Cambodia is providing data and evidence generation and cost effectiveness, efficiency, and sustainability approaches to people living with HIV, which is why we've been trying to look at how much social contracting will cost and what are the priorities there. One big investment UNAIDS is doing here is capacity building of partnerships. We've really been providing support to what we call FUNPAM, the network of people living with HIV and most at risk of HIV, in order to make sure that they have governance, leadership, and evidence-based advocacy roles and capacity to move forward. And lastly, and I mentioned it earlier, we mobilize resources jointly. CSOs, government, and UNAIDS have mobilized funding from Australia and France to develop the Sustainability Roadmap, implement activities from the Sustainability Roadmap, and assess how Cambodia will be ready for least development country status, which is graduation will be in 2029, meaning we're looking at what a core package costs, what a community-led response costs, ensuring that there's health finance literacy training for CLOs and people living with HIV, ensuring that there's seed money to look at income diversification projects so that you're not reliant on social contracting alone. So these are things that UNAIDS is doing with people living with HIV-led organizations, key populations, and other CSOs in Cambodia. Last slide, please. So just to end up with saying, we must do it together, but it's also an iterative process. As you can see, our journey has been going, renewing our roadmap. And it's this iterative process that ensures inclusion, comprehensive conversations between all the partners that are needed, and pushing the boundaries of a sustainable approach in the HIV response. So once again, thank you so much for inviting me to this wonderful webinar, and just saying apologies, I won't be here until the very end because I do have to board a flight very soon. Thank you.
Thank you so much, Patricia. Thank you so much for sharing the experiences and for providing us some insights on how it can possibly happen at the country level. Patricia, there is a question for you at the Q&A. If you're able to stay with us a little longer, or feel free to respond to the question of Muhammad in relation to the domestic funding. Thank you so much. Thank you so much, Patricia. Now we are in the important question. Like we have heard from UNAIDS Sustainability Roadmaps, Part A and Part B, the human rights based approaches, the human rights and community approaches, the risks, the community participation towards sustainability. But how are we going to make sure that the resources are available for these engagements, for making sure that our engagements or that the sustainability exercises and the implementation of sustainability plans are well resourced, and making sure that they can run with the community at the center. I'd like to invite our next panel, Anthony Kinghorn, the Health Finance Specialist for the Global Fund. Welcome and thank you so much for joining us tonight. How, like from the speakers, from their points earlier, how is the Global Fund working to ensure that sustainability planning processes protects and expands access to essential HIV services, particularly for communities who are most affected, including the people living with HIV? And what are the mechanisms that exist within the Global Fund processes to promote equity in financing and programming? And how can we, the PLHIV networks, more effectively engage in these mechanisms? And as countries transition toward domestic financing and long-term sustainability, what are the safeguards in place to ensure that the PLHIV-led and community-led peer support and rights-based approaches remain central in the national HIV responses? Anthony? Hello?
Yes, Inad.
Anthony is. Or maybe we can, so we can go through, while waiting for Anthony, we can go through the questions in the Q&A box. So there are very, very nice questions in the Q&A box, and we are looking forward for the interaction later. So there's a question about the U equals U, the I equals I or K, and the messaging on the undetectable equals untransmittable. Like their inclusion could strengthen community ownership, reduce stigma, and reinforce sustainability. Are there plans to integrate this language directly moving forward? That's a nice question. There's also a question from our colleagues from Myanmar, where we, like, without clear enabling environment, how would we weigh pros and cons if pushing into this agenda, and what is the perspective in ensuring pair-based be treated as same as other CHWs who are trained? Yeah. And then there's one wonderful question about the engagement of women and girls and their networks in the sustainability roadmap processes. I think that's a nice question. I think our colleagues from the Global Fund are ready. Hi, Keith.
Hi, Nad.
Hi, Anthony.
Sorry about the technological glitches, but at least now I've got a camera so I can speak to you like a person. Good afternoon and good evening, colleagues. Sorry about the delay. I'm here with my colleague Keith Meanies from the Community Rights and Gender team, so that together we can hopefully respond to whatever questions come up. In trying to craft a response to the three questions, I think a lot of the issues overlap. So I'll introduce the session just by going through some of the broad important principles and approaches, and then we can respond to questions that you have. And I think one of the key issues is that the Global Fund has really been set up to champion community engagement, both as a principle and as a core element of its implementation models as we go into the sustainability planning phase, not only the sustainability plans, but also subsequent deeper dives for grant cycle 8, as well as in specific program subcomponents. And the community engagement is structurally embedded in the Global Fund, first of all, from an architectural point of view, from the board level to various committees, and then through to the country level. So I think it's really important as a part of the strategy to make sure that that communities remain at the center, to engage at each of those levels as the community that you are. I think once you get down to country level, it's really important to see the CCM and participation in that as the primary entry point for people living with HIV and other constituencies to influence the resource allocation and priority setting going forward. This will be critical to make sure that the sustainability discussions take into account the priority needs of the most affected people. And it's heartening to know that the large majority of CCMs do have representation of people living with HIV, but we know that it is a challenge that we'll need to work together to make sure that that is as effective as possible. When we step back from the kind of structures that you can participate in, I think that it's important for colleagues to look at the grant life cycle, because there are various stages in the grant life cycle that are create specific opportunities for engagement of communities. And that starts with even the preparation for the funding application stage, which at the moment would include things like roadmaps, but also going into GC8, which is going to be where the first wave of applications is probably going to be submitted in the middle of next year. It's really important that the communities start engaging with some of those processes. And then as you go through the implementation of the current grants, as well as GC8, make sure that you, through your CCM and other opportunities like evaluations, your voice is heard and priorities are registered to make sure that that at each stage you influence the way things that happen. I think it's important to say, as we look forward to the next big funding milestone, which is Grant Cycle 8, that engagement both in national strategic plans as well as the roadmaps, insofar as they are separate, will be really important, because it's likely in this global fund traditional way of working, we try to work with documented priorities and structured priorities from NSPs. And so to make sure that communities engage with that will be really important. I think one of the things that is also worth noting is that in Grant Cycle 7, the current grant cycle, quite a few minimum expectations were introduced in relation to community engagement. And they were aimed at increasing transparency of processes and accountability and opportunities for community engagement. And so examples include in the funding request development, the community priority annex, which are there to try and make sure that consultation is structured and priorities are registered. And similarly, there are requirements for communities to be engaged in the stage of grant negotiations, for example, that you should also make sure are operationalized effectively as we plan for the next while. So looking ahead, it will be key for networks to be ready to influence GC8. Just a couple of things to watch out for in the process going forward is the Global Fund guidance on a number of content and process aspects is going to be coming out probably in early to late November. And that's going to cover things like value for money, which will be a critical part of making prioritization decisions. There'll be specific new guidance on HIV interventions, which is likely to include some guidance on prioritization, and also register the importance of community-led and community-based responses. So make sure that you're familiar with that guidance and can use it as effectively as possible. And then there's going to be other guidance, things like in areas like health system strengthening, which may also be important to framing your priorities and making sure that they're funded. So I think be aware that those are coming out soon, and then make sure that you are tapped into the next funding cycle. As I said, first submission window probably mid-2026. Then one other opportunity that will be important for many of you will be there's a community engagement strategic initiative, and this is going to provide funding for short-term technical assistance, and that's going to be available to communities specifically to develop things like priorities and advocacy that will influence GC8 grants. There may also potentially be opportunities for influencing roadmaps. I think Keith will have more idea about the scope and the timing of it, but that will hopefully be a resource to you as well. Perhaps just to take a step back in terms of the way that the Global Fund is trying to ensure that plans and the strategies going forward protect the essential services. I think one of the key priorities that the Global Fund is reinforcing, both in our own work as we try to grapple with all the ups and downs of shifting funding landscapes, is we really have to stay focused on saving lives and impact. And so I think that in so many of our contexts really reinforces the need to work well with communities and to reach communities that are essential to impact and effectiveness. Then I think that we'll be collaborating with UNAIDS in the sustainability planning process in various countries, and hopefully we'll be able to engage with communities to help to reinforce key priorities and make sure that they get into GC8 planning, because we anticipate that CCMs are going to need to have quite strategic approaches well before they submit their Global Fund applications. Otherwise, if some of them lean towards doing things in the same old way and the same old things, that might miss the boat on some critical issues, for example, that might have been sustained by other funders. And similarly, if we jump to new things or ill-considered priorities, we might end up having neglect of some of the things that have been really important to the response in the community response from now. Then we're also in the Global Fund going to be working with other partners to try and get a more granular understanding of the funding landscape in various countries and where the gaps are going to be. I think that this is going to be critical to make sure that where there are gaps to support the community-based response and protection of key populations, for example, that we've got a clear idea about where those are and how we're going to deal with them together. And we're also going to be working on things like domestic resource mobilization and trying to improve the efficiency of existing interventions, both for priority communities, but also more generally, where often there are even bigger inefficiencies and potential savings that we need to capitalize on to make sure that there's funding space for the priorities that really need to impact. So I think one of the other things that is being looked at is development of differentiated models for different kinds of responses. And Keith, I think, will probably have some insight into perhaps new ways or different ways of doing things to cope with financial constraints that are coming out of recent processes. And then there will, in the grants themselves, be opportunities for the communities to mobilize resources to do things like develop social contracting mechanisms as part of the longer term sustainability approach and various other building blocks that might be critical to sustainability. So I think from the Global Fund point of view, we really do focus on country-led initiatives and country-led solutions to various problems. And so it's really very important not only to engage with us, but also to work with us to make sure that your country-level engagement is effective in helping to direct the country grant resources in the most useful and effective way. I'll invite Keith maybe to make another couple of comments if you'd like, otherwise we can wait for questions.
Yeah, thank you, Anthony, and hi, everybody. Keith Muniz in the CRG department here at the Global Fund. I mean, I think Anthony captured it all. I think just a last bit of advice as we head into the next cycle of investments, navigating a very challenging landscape. And I think not only international funding, but also domestic funding and opportunities for community-led responses and community-led organizations to be sustained. It's really important to go into these conversations with the strategic information about value for money and the effectiveness of community-led implementation and service delivery. I think Clayton earlier mentioned community-led monitoring, Shodit Patricia and the sustainability plans, and folks from Africa and their experiences clearly speaks to community system strengthening needs for improved sustainability. It's one thing to say all these things, it's another thing to be able to actively engage and provide data and information to strengthen the priority area for these things to continue being funded, especially when there's a lot of prioritization that needs to happen within prioritization, not only here at an international donor level, but also in countries. There's issues that are becoming more pertinent and a lot more challenging to address. And I think the effectiveness, the quality, the equity that community-led responses contribute towards and actually results in impact can't be ignored. But it's really hard to quantify those in a larger conversation. And as much as we're wanting to develop these ideal plans, it's also important to get to the what and the next steps and how are we going to action these plans. And so as we consider these sustainability roadmaps, at the same time, we should in urgency think about how are they going to be implemented? Who is accountable? How do we continue monitoring whether these things happen or not? And what can we continue doing as part of, strategic advocacy, as what many of you on the call are incredibly good at. And that's the value to keep these things funded. But very happy to answer any questions along with Anthony, and thanks for the opportunity to be here.
Thank you so much, Anthony and Keith. And I think you have covered some like broader aspects of the Global Fund, and also the different opportunities for community engagement. There are several questions here. I have my questions myself, but let's have the questions from the community. Thank you again, Anthony and Keith, and thank you to all our speakers. If I can invite the speakers, the panelists to, if you're happy to turn on your cameras or your videos, and then maybe we can start the discussions. And I'll be asking the questions, and maybe whoever can respond. So there's this question about the non-negotiable for community engagement. I think this goes to UNAIDS, Clayton or Jaime. From the community, what leverage do we have to ensure countries and partners adopt and implement these non-negotiables?
Yes, maybe I can. Should I try to respond?
Yes, Clayton.
Thank you. Thank you for the question. I think the idea of having this guidance that we are almost finalizing is really to be used as an advocacy piece. And I think that what Patricia, in her last slide, I think she responds this in the sense that we need a joint advocacy. We need, as UNAIDS, you can count on UNAIDS to do that advocacy at country level, but we hope and we aim to do this advocacy together with communities to make sure that the standards, the non-negotiables, whatever we want to call them, but the principles, but that community-led responses is really central and is prioritized in the sustainability planning. Yeah, I'll stop here. Thank you.
Thank you, Clayton. Jaime?
Maybe I would just add one comment, and it's a general comment. It's been really great to listen to how some of the community colleagues, our colleague in Tanzania, and some others, and comments in the chat, have highlighted the relevance of being advocates for domestic financing and of being advocates for the right things, and using the roadmap process as a vehicle. That is simply great, I think. And my colleague in the Global Fund was speaking now at the preparations of GC8, and we know that in whatever shape soon will be bilateral negotiations of PEPFAR with countries. So the sustainability roadmaps, the national discussion, the opportunity to have a clear vision on where to go is simply a tool in the hands of governments, and should be a tool in the hands of communities to influence how the vision and how the decisions are being made in all these instances. So I think the integration of those discussions is critically relevant. And let me say just that this is a highly political moment. We are all very aware of this, and having clarity in joint messages, I guess in some cases we've seen this, and we've talked with colleagues in GNP Plus, with our team, our communities team, and with our partners. It's important that there is a strong network that comes together of people living with HIV that may have some shared vision. We are offering this guidance that has been discussed and Clayton has presented and prepared in collaboration with many community organizations, but all efforts to bring together the key things to pay attention to, the key ways of engaging, and to support what are the elements that can be supported, as Anthony was saying, in the CCMs, as the things advance for the next cycle. That's a key tie. We have to keep that clear vision and priorities for communities very, very present. And that would be an invitation. And you know that UNAIDS, Clayton, my colleague, and all of us will be we'll stand ready to collaborate to strengthen that tie, but it's a very political time, and it's important to acknowledge that and to be ready to bring forward what are the key things that will make a difference for communities and engage in discussions, as Wongile said at the beginning, on integration discussions, on domestic mobilization, discussions on the budget allocation elements. All those are key opportunities. So I just want to say all our support, and keen to continue engaging, and I see a fantastic focus in the discussion from your end. Over.
Thank you. Thank you so much, Jaime. I'm also inviting the participants to please raise your hands if you want to speak. We can unmute the microphone for you. Maybe Randy, if you want to share that, you can share that by yourself. And Andrew Tan from Malaysia, if you want to share that question, please feel free to raise your hands, please. And I'd also like to highlight one comment from our colleague from MENA, that in terms of, or in relation to community engagement, we should also not forget the engagement of women living with HIV, and children, and those who are living with HIV who are not able to speak for themselves. I think that that's really important. But if so, I think there's one hand raised, Bernice Jacobs. So if you're still there, I welcome your points. But there's another question for the Global Fund, maybe Anthony or Keith. So there is a trouble in Malaysia. Funding for the latest program, differentiated HIV services for key populations, comes from the Global Fund. The Ministry of Health and the Malaysian AIDS Council has seen fit to ask NGOs to host the team of community health workers, PrEP navigators, and peer navigators, but have totally removed any and all funding support toward, I think, the operational cost of NGOs, so payment for the rents and utilities. So he's saying that the removal is unjust and unfair. Any thoughts on this, Anthony or Keith, that you have, or like what's your advice for the community? Because I think this is common from the community organizations, not only in Malaysia. I think that's across the countries. It's pretty much common where the funding has been reduced or eliminated, like budget lines are eliminated, especially on the operations of community-led organizations. There is funding for service delivery, but there is no funding for how to operate the community organizations. So what's your advice? How do we approach this kind of scenario?
Maybe if I can just start from a kind of health financing perspective, I think one of the key things that can be considered is whether that kind of funding can become part of the co-financing commitment that the government makes as part of a transitional sustainability plan. I think that a number of countries have been quite successful at formalizing support for key components at the grant-making stage, making sure that they're built into co-financing commitments. I don't know the specifics of Malaysia, so I'm not sure that I can comment on that.
Yeah, maybe just to add. Sorry, go ahead.
Sorry, Andrew Tan has raised his hand. Maybe Helena can, yeah, go ahead, Andrew. Sorry for the interruption, Keith.
No, I'm happy to hear from Andrew. Go ahead.
Hi, can you hear me?
Yes.
Yes.
Please go ahead.
Okay. Hi. The issue that we have right now is that we have done a lot of work with the Global Fund from 2014, when we first were awarded the grant for a innovative pilot program to outreach to the MSN community to get them to come in for testing and to get them screened, as well as referred to services. The problem is that previously the funding budget included a couple of 100 Malaysian ringgit for the rental, and it helped greatly in supporting us, because we just had to look for the balance of the funding for the rental and utilities, the water, electricity, and everything, because you can't have people working in the office and tell them not to use the toilet or not to use electricity to do their work. But the thing is that this year it just totally disappeared. There was zero funding, and they basically asked us to look for it ourselves. Thank you very much.
Yeah, Andrew, thank you so much. But before Keith leaves, let's hear from Keith. Like your points on that before you leave. Thank you so much. Thank you so much, Andrew.
Thank you, Andrew, for raising these concerns. I must admit, you're not unique. In that instance, the Global Fund had to go through two very vicious reprioritization exercises very recently, and there's been a very explicit guidance that's been published on considerations during reprioritization, and even the March-April pause and deferral guidance that applied to programmatic financing. There are definitely ways in which you could escalate this. Would be my first advice through CCM, the PR, to note what these needs specifically are. I think one of the things that's explicit in the guidance is to ensure that there are sufficient support for community-led and based organizations that support program implementation and service delivery, that continues in line with the coverage of the program or the service delivery scope. So at some point there's some tough choices to be made, but I mean, as you were explaining this and the longstanding role that you've had as an implementer supporting DSD for key populations in Malaysia is of course a priority and should continue being. But along with what Anthony was saying, I mean, there's different sources you could tap into and potentially do advocacy with for additional financing, where donor financing are becoming a bit more rigid in what we can fund with the resources that are available. But continue doing this advocacy, continue pushing it up through the right channels and making sure that the need from these NGOs and these partners that are supporting DSD in Malaysia for key populations are consistently visible in future negotiations.
Thank you so much,
Thank you very
Keith.
much.
Thank you so much, Andrew, for raising. And I think that's a common concern. And I think as part of the next step, we have to have more detailed discussions on like the community level challenges in terms of engaging with the national budget, particularly in the Global Fund or at any national HIV program, accessing funding not only for services but also operations of the community. Thank you so much to our friends from UNAIDS, from Global Fund. Thank you to our speakers, Cyprian. Thank you so much. Thank you, Jaime. Thank you, Clayton. Thank you to our participants for tonight. We have a very, very wonderful discussions. But before we go, I'd like to call on Florence. Florence, hi. Florence Vieco, and the co-executive director of GNP Plus, to share some closing remarks and maybe some next steps, like how do we move this forward after this. Thank you. Good. Over to you, Florence. Oh, yes, can hear you. But yeah, go ahead.
Then I won't take a lot of time. I just wanted to say thank you to everyone because I'm really travel and I just stopped somewhere to listen to the tail end of this call. I think we have learned a lot today. I agree with all our presentations and speakers, particularly from UNAIDS and Global Fund. We are existing in a very, very political landscape, but with a lot of transformation and transitions happening at our country level. So it calls for us to be alert and to be able to understand how to engage with our networks and participate in the plans and the decisions happening at country level. In terms of next steps, we will make this webinar available. We are doing a lot of podcasting. I kind of think everything is a podcast now, but we will make this webinar available on our socials and we will share it with you. And I believe it's going to be a learning for you to share with also other colleagues at country level. At GNP Plus, we are committed to engaging with all our PLHIV networks and those impacted by HIV at country level to help strengthen those mechanisms. We are going back into the countries, but we are the people that are sitting in those countries, and we can collaborate strategically with our governments, with our ministries of health, with our HIV programs, with the support of UNAIDS and Global Fund and WHO and other partners to ensure that services reach us in a way that works for us. So thank you so much for all our speakers. We were about over 80 people today convening to learn together. It fills us with so much joy. Thank you, and wishing you a good week.
Thank you so much. If you have any questions, please send me an email. If you want to be included in the announcements, please send me an email. And also, if you have any recommendations or any discussions that you want to have with agencies, global agencies where GNP Plus can help organize, please let us know. We're happy to help. Thank you so much, everyone. Have a good night. Please keep asking questions. Send me an email. What's happening next? I'll be happy to respond. Thank you so much. Thank you so much. Have a nice night. Thank you. Bye-bye.
Thank you.
Thank you. Drop my email. Okay, my email is... There you go. That's my email address. So thank you so much.